The Truth Occurs.
Hi everyone, Sonia here. I wanted to tell you about a new therapy that I'm doing with my son who has autism spectrum disorder. Making this video for all the parents out there who are like me, you know, looking for answers. So there's a lot of different approaches out there, I guess, but one of the really popular ones is ABA, Applied Behavior Analysis. They have a new name for it now, but whatever, it's the same thing. It's like you look at what really motivates the kid and then you force compliance by rewarding, like every time they approximate the behavior or perform the behavior, you shape it. It's really just like dolphin training. It's something that could be done in a therapeutic setting, like with a therapist, or an institutional setting like the day program my son went to. But let me tell you, it's something that's very hard to maintain at home. It's very hard because you have to be like right on it all the time. It's very hard to do this when you're taking a shower, or you know, doing your grocery shopping, or cleaning your house, or trying to get some work done, or whatever you're doing. It's very hard to do ABA when you're trying to actually live your life. And my son had some ABA therapy for 2 years at the JGH day program, but it's not something I could continue in my own home. I mean, I do a little bit of it, like I'm pretty strict with rewarding and on the other hand consequence, or like withholding a privilege until he performs a thing, but whatever. I can't do this like minute by minute all day. With a kid who's developing more typically, just a little bit of reward and consequence is enough. But with the kid who has like ADHD or ASD, the parenting, like the level of intensity, it's pretty full on. Oh, I don't even want to talk about it. Like just even talking about, whew, getting hot now again. Just just talking about the intensity of the parenting experience is stressful. So I don't want to go there. And actually, like, that's why we started doing this new therapy. It's called Nurtured Heart Therapy, which we're doing with Linda Aber through the Montreal Center for Learning Disabilities. So if you're a parent in Montreal and you're interested, well, I'm going to tell you about this Nurtured Heart Therapy. So it was developed by Howard Glasser, who's a psychologist, to address severe behavioral problems. And it's a very different approach. It's like, I'll tell you a few of the things they say here. They say it's a system in the relationship where basically you give all your attention to what the kid is doing right, little or no attention to what they're doing wrong. Although you are supposed to give consequences that are swift, emotionless, consistent, and non-punitive. So it's not like you let them do whatever they want. But basically what it comes down to, it's avoiding emotionally reacting. Avoiding the yelling, the nagging, the repeating. I mean, really, you know, when you have a kid who's very self-centered and really not doing what they need to be doing, like let's say you're trying to leave the house, and like for my son, one big issue is putting his socks and shoes on. And yeah, he's just almost 11, and still the socks and shoes, wow, it's a really huge issue. And it's very hard, but you have to stay cool, because if you just, the yelling is not going to do it. So if you add yelling and punishments, all it's really going to do is undermine your relationship. I already kind of knew that. We're already doing this. I mean, look, I'm with him most of the time, almost like 100% of the time. So even knowing this, it's hard to keep your cool all the time, because I'll speak for myself, I don't know about you, but I'm human. So sometimes I really get to like the limit of what I can take. But the goal is basically to stay cool, to reward good behavior, to create good feeling interaction with your child, and to not get into it with them, because otherwise you can get in one of those relationships where it's like you're always yelling, you're always nagging, and it disrupts the bond. So this is like an attachment-based approach, where what you want to do is you want to really strengthen the bond, and you want to raise your child's self-esteem. Because destroying the bond, lowering self-esteem, those things are all going to work against you in your parenting. It's going to work against them in their development. This isn't really news to me, but I mean, you know, this is part of their approach, which is why I guess it's an approach that I like. I like the idea anyway. We'll see how it goes. So I'm not going to read you the whole thing, but they have a bunch of different techniques for creating a better bond between you and your child, creating like good feeling memories, highlighting what the child is doing right, highlighting the good feeling interactions. As for the consequence part, I mean, you know, with ABA, you have very, very, very clear reward or negative consequence, which like I said, I don't do ABA all day. I mean, I'm not an ABA therapist, but I do use that approach. Like, we use the 3 strikes approach. Strike 1, strike 2, strike 3. My son has been trained to that. We've been using it a long time. I find it works. I usually don't have to get to the 3rd strike. But I'm pretty consistent, like, as far as enforcing the discipline goes. But the thing is, you wouldn't know it if you saw my son's behavior, because his behavior is, on some levels it's okay, but on other levels it can be very inappropriate. Is, like I say, it's still hard to get him to put his shoes on and stuff like that. But it's not for lack of discipline. So as far as the consequences part goes, I'm sticking to what I've been doing. But the goal here for parent and child is to decrease the stress, decrease the yelling, and it's to teach the child emotional control. Teach them a bunch of things, but emotional control is one of them. That's where we're at right now with the therapy. So she gave us a bunch of other handouts about being a social detective, looking for social cues, which I guess doesn't come naturally. And even though if you do see the social cues, you don't always know how to react to them. What I find with my son is he may see them, but he's so in his own mind, in the way he thinks, he's just so naturally self-centered. Like, if he thinks something is fun, well, it must be fun for everybody. Like a baby. Or if he's enjoying doing something, to him it seems so important. He's just so in the moment that he might see that other people are like standing around getting tired of waiting for him, but I think it's that there's like some amount of impulse control problem. It's hard for him to stop what he's doing, pay attention to other people's cues, and make that the priority. That's the thing. Making other people's cues the priority. That is hard. Because he might see them, but he may not make them the priority. So whatever, we're going to work on that. But for what we've been doing so far, though, is regarding emotional regulation. Well, I hope this is useful to you. So there are 4 zones. There's the blue zone, the green zone, the red zone, and the yellow zone. The blue zone being like a down mood, sad or tired. The green zone being the good, alert, happy mood where you're ready to learn. Yellow zone is like where you're starting to get irritated, and red zone is kaboom. It's where you're like losing control, or where you've lost control. And so the goal is to learn to regulate yourself emotionally so you don't go in the red zone, and when you're getting into the yellow zone, you go back into the green zone. Now, I'll tell you, I've had my own problems with emotional regulation, and I have a lot of tools. And I mean, I say I have problems with emotional regulation because of the level of stress that I'm dealing with all day with my son. And I could go into the yellow zone, but it's like it happens all day. It's hard to put yourself back in the green zone. I think that personally I have found a way to cope with being on the edge of the yellow zone a lot and just control myself. So this is the goal, though, for the kids, is to avoid what Linda calls like flipping your lid. So like, this is your brain normally, and all your bad unthinkables, like your bad emotions, are in here, but your executive function keeps them in check. When something starts stressing you, dysregulating you, it starts to go like this. So these things can come out, and pop, when you flip your lid, this all comes out. So the goal is to keep a lid on it, so all that crazy stuff doesn't come out. Well, crazy, you know. So you don't want it to come out. Easier said than done, though. Easier said than done. Because I'm going to show you some of the tools. And I'll tell you, I use these all the time, and I still feel like I'm about to flip my lid a lot. See, my son doesn't know that. So I must be doing something right. Because when we went to the therapy, she asked him to describe his mom, and he said, patient. Doesn't hold a grudge. Like, he described me as someone who's calm and patient. Let me tell you, maybe I look like that on the outside, but I don't feel like that on the inside. And I think it takes a toll on me. It's hard. It takes a toll on my mind. It makes me depressed, and it takes a toll, let's say. But at least I'm not doing this. Somehow, I managed to keep control. So, there was a couple things. Where are they? Oh, we put them in here. Whoops. So here's an example. She has all these lists of things you can do to keep from flipping your lid. And some of them were breathing techniques. That was one aspect of it. And the rest were things like this, different things that you can do to try to diffuse your stress and your bad mood. I have to say, I've been doing this myself for like forever. It does work. However, let's say you're trying to get the child on task. They're very irritable and they start going this way. And yes, you can use this. But in my experience, even with myself, it doesn't take 5 minutes to go back down. I mean, maybe for some people it does. But for me, it doesn't. It could take half an hour. I, even at my ripe old age, have to take a lot of breaks like throughout the day to keep myself okay. So I thinking my son, maybe it's the same way. That you are so sensitive, highly sensitive person, you know what I mean? So sensitive to your environment, lights and sounds and stuff, and sensitive to stress. Like, I'll tell you, like, hearing him talk all the time, I can't stand being around too much talking. I can't even do too much talking myself. Even doing these videos, sometimes it starts to get really hard because it's too much. I mean, there's times where I'm really chatty, but there's times where I need quiet, no talking. So when you're like that and you really need these like quiet times and you're with somebody who keeps talking, that's for me, that's like, it's gonna put me here. And I get that from a lot of things. So I'm thinking, I don't know, do they think really that you can just send yourself back into the green zone like in a few minutes with this? Because I don't think it's realistic. I think it depends on the person. But for someone who's highly sensitive, you might have to do these things many times throughout the day for extended periods of time. But you can, and you will, if you take the time to do that, never get to this point. So some of the things on the list here: listen to music, squishies, take a walk, do jumping jacks, you know, like all different fidget ball, whatever, all different things that you can do to calm yourself down. You got to find the ones that work for you. And the other thing are the breathing exercises. Breathe. And why it's important is that apparently when you start getting stressed and your body's producing a lot of adrenaline, cortisol, the blood is rushing to your extremities for fight or flight purposes, and less to your brain. So then you have less oxygen available to your brain, and that decreases your executive function. I thought that was really interesting to know. So the breathing is oxygenating your brain so that you can get control of yourself again. And it does work somewhat. I mean, I do it all day. I kind of have to. These other things, you want to teach your child to use them. Again, though, like I said, this doesn't mean that if you have a demand that you can just say, take a breath and do this for 5 minutes and the demand will be met. Because what I find is my son can re-regulate himself, and he still won't meet the demand, so we're not there yet. But I'll give you an example of how I deal with this myself. Like, if I'm around people too much, surprisingly, like introverted, I guess you could say, around people too much and I get really irritated and I feel like, oh, I don't want to hear any more talking and I don't want to talk. I need quiet, so I do like silence. I try to encourage my son also, let's have some silence, but he talks nonstop, so it's hard to get. Silence, breathing, and even I like to sing. I like to sing worship songs. And it could take a half an hour of silence and then singing worship songs. After half an hour, I will be in a really good mood again. So I'll go from ding to back down, but it takes half an hour. But it does work. Because if you're in this place, you can't think straight. And you're liable to freak out, make bad decisions, and end up here. And that's something that's really important for our kids to learn. Again, it's not necessarily going to happen quickly. But to me, that's okay. Because you know what? I'm highly sensitive, and my lid goes this way a lot. And yet, people don't see me flipping my lid because I do this kind of stuff. So Gunnar now has this toolbox here. And inside the toolbox is like all the different things. And some of them are ones he does not want to do, like to get tickled. That would really send him over the edge. Some of them are totally impractical, like swing. Oh, really? Where are we going to do that? Take a walk? Yeah, but he's got to get his shoes on. We can't just take a walk. Run? Really? What, in the house? Maybe down the hall? Jump on a trampoline. Look, like half of these are already out. Inner coach. I can do it. Yeah, okay. If you have an inner coach. What animal walks? Ugh, let me find one that we can use. Jumping jacks? Let me find one. It's Most of these are ones that he's not going to use. Take a break. That's a good one. When you're starting to lose it, just give up on the task temporarily. Take a break. Not very practical at school. But at least you can learn that, you know, when you're really getting frustrated, it's really not working, just throw in the towel, take a break for a while. So let's say we choose take a break, and then we do a breathing technique on top of that. Like there's balloon breathing where you inflate the balloon and then deflate it. That would be really good. Problem is, my son gets really angry when I try to get him to do the breathing techniques. So it's not that easy. But we have this and maybe the squishy ball, fidget ball. This is probably the one that he's going to use for now. And I'm encouraging him to use the breathing, but let me tell you, it's not easy to get him to do it. I think he's probably getting a lot out of hearing about this and seeing it in this really nice visual way, plus seeing me do it, because I do it all the time and I'm very open with him about how I deal with my own hypersensitivity. And I mean, really, it's even with me, it's like at the point of being debilitating, I guess, in terms of how much I can get done in one day, because I need a lot of these like times where I can decompress before I can go back in the ring and start doing things again and interacting with people. But so it goes. That's how it is for me. It's probably going to be like that for him for the rest of his life too. Might as well learn how to deal with it. And so when he does use it, I give him the tool award. I don't know what Linda would say about how I'm presenting this, but this is my experience of it so far. I really do hope it's useful to you. Tool awards. So far, we've done 3 sessions, well, including the intake session. What it's done for me is kind of make me think about what I'm using. Have this all in a very concrete way. I'm also doing some of these educational thingies with my son. And I'm trying to encourage him to do it, and it's just making it more concrete. And as I'm doing it myself, I'm trying to encourage him to see like what I'm doing. So I'm sort of modeling it for him. But I'm seeing that this is not going to be any kind of easy fix. It's going to take a while. However, these are very good tools to have for the rest of your life. Have I seen any dramatic improvement? No, not in him. I mean, I'm trying to encourage him, like I said, to do this, but the improvement I guess I see is in me. I'm doing it more. I'm doing more breathing, and I'm more conscious of how I'm using these things. So ideally, if he can take the approach I'm doing and really think about it, really work on it, and be like, okay, I'm in the yellow zone now. Okay, it sounds silly, but I'm in the yellow zone. You know, I'm here. I'm now going to like be quiet and breathe and maybe sing some worship music or whatever until I get back in. And that is me doing this stuff. Although I was doing that already, but now I'm thinking of it like I'm doing this. I'm realizing that this is what I'm doing. I've been doing it all along. Now, if only I could get him to do it. But for now, what we got is like maybe a couple of these. But what I do see with him is he's starting to have more awareness of when he's starting to go into that dysregulated yellow zone. Doesn't mean he's going to go right back in green and ready to learn again. Like it says here, the goal, ready to learn, like in class. But at least he might not get to this point. And so that's it. I hope this is useful to you. I know it was long, but I hope it's helpful. So thanks for listening to me. Thank you for giving me thumbs up. Thank you for your support on Patreon. Like I said, thanks for listening to me, and I'll see you next time.